Good evening, this is Dawood from the American Vision University. Here I will highlight my case analysis for the midterm assignment in the class of healthcare economics. As we know that at 18% of Americans' economy and growing 2% faster than gross domestic product, both the level and rate of growth of national healthcare spending are seen as alarming. While this is not a new problem, the amount of spending on healthcare combined with the country's physical challenges make the need to contain healthcare costs a national priority requiring a sense of urgency. High healthcare spending is alarming the government and strained physical situation and hurting the standard of living in many Americans. The case that we have is that when President Obama signed the ACA earlier in this year, in the year, he declared it would lower the cost of families and for business and for the federal government. The early evidence contradict his claim. Private insurance costs are up, estimated healthcare spending is up, and Congress is already considering regulations to give state the power to reject rate requests that are considered unreasonable. To solve the spending problem, we must understand the causes. We have strong consensus that healthcare spending is too high and growing too fast. But this has not led to agreement on the causes or the appropriate response. We have three case questions. The first case question: what are the main cost drivers causing the high rising in spending? There are many drivers causing the high rising spending in the from healthcare in the United States. Here are some of them: intensity of care, lack of coordination, lack of management, also provider incentives, medical technology also. Chronic diseases affect lack of patient engagement, also thinking medically, not physically, and lately lack of evidences. All are some of the main factors that might cause the increase in the cost of healthcare. The second case question was: can we reduce spending and expand access to additional 40 million Americans simultaneously? The answer is maybe yes, maybe no. Most probably yes, but it needs a strong actions and a strong efforts to be done. It's not easy at all. Many actions should be done, and policymakers should build on a progress made by the Affordable Care Act by continuing to implement healthcare insurance, marketplace and delivery system reform, increasing federal financial assistance for marketplace enrolls, introducing public plan option in areas lacking individual market competition, and taking actions to reduce prescription drug costs. The second case question was: are price control the answer? I don't know. Maybe yes, maybe no as well. But when I review many of analysis, all of them said yes, it can be, because controlling the price would be a straightforward means to reduce spending relative to more complex task of reducing the quantity of service, of developing policies that would directly regulate quality of care and future technologies changes. Price are easier to measure and monitor, whereas decisions that affect the quantity and the quality of care require more complex processes and subjective judgment about the value of a specific service to individual and to the society. Thus, policies that would affect the price of service are perceived by many as the most manageable approach to achieving control over health spending in the short term. How will they affect the healthcare market? It will impact the healthcare market on many levels. For example, more service may be provided by billing practicing may change to offset the reduction in providers' revenue when the prices are reduced. Provider may substitute other services for those whose prices are controlled. Price controls implemented for a specific population group, such as Medicare and Medicaid, may result in a higher prices charged on increase or an increase in service providing to other population group. When prices are controlled for only some groups, those groups may have reduced access to health care or receive lower quality service than others. That's why a lot of efforts should be done. Policies should be implemented for all over the country in order to achieve it. Thank you so much.